Approximately 10% of Canadians have hearing loss. 30,000 of those are children. Half of the time, hearing loss is due to non-genetic factors, such as a baby being born prematurely or a mother and baby having an infection during pregnancy. The other half of the time, hearing loss is due to genetic factors or inherited gene variants. Genetic hearing loss can happen even if there is no one else in the family with hearing loss. There are two types of genetic hearing loss: syndromic and non-syndromic. A syndrome is a disorder that has more than one health issue or symptom. Hearing loss in a syndrome may be the first sign, but the other associated health problems may not develop until later in life. An example of this is Usher syndrome, which can cause both hearing loss and progressive vision loss. The hearing loss is usually present at birth, but the associated vision loss starts later, from childhood to late teens or early adulthood. Your healthcare team can advise you on whether or not further investigations are needed to rule out syndromic hearing loss for your child. When a person has isolated hearing loss, this means that aside from impaired hearing, they have no other health issues. Isolated hearing loss is considered non-syndromic, or not part of a syndrome. 70% of genetic hearing loss is isolated or non-syndromic. The majority of non-syndromic hearing loss is due to variants or errors in a specific gene called GJB2. GJB2 tells the cells of the inner ear to make proteins, which are important for normal hearing. When a genetic testing panel for hearing loss is done at SickKids, the laboratory first looks for those most common variants in this gene. If no variants in the GJB2 gene are found, then a group of other hearing loss genes is examined. Sometimes a gene variant in this group can be found that is associated with a chance the child could develop other health issues. Genetic hearing loss may increase the chance for hearing loss in other family members. There are many reasons why people choose genetic testing. They want to understand the cause of hearing loss in their child, or to know if their child has a chance to develop other health problems, such as in a genetic syndrome. And finally, to find out if there is a chance of it happening again or recurring in the family. When genetic testing is done, there are 4 possible results that can be expected. Testing can reveal a positive result. This means one or more variants that explain the hearing loss have been found. If the testing reveals a negative result, this means no variants or explanation for the hearing loss was found, but this does not completely rule out a genetic cause. Since our knowledge about gene variants changes over time, people with negative results are encouraged to check back annually for updates. Another possible finding is a variant of uncertain significance. A variant of uncertain significance is a gene variant that we currently don't have enough information about to know if it is related to hearing loss or other health issues. Sometimes, when found, further testing and evaluations are needed. And finally, a secondary finding could be identified. This means that a variant is found that increases the chance of another health condition to develop that is not related to hearing loss. It is rare to have a secondary finding in a hearing loss panel. It's important to note that sometimes a blood sample or a hearing test is needed from the parents to clarify the results in their child. And remember that a negative test result does not rule out a genetic cause for hearing loss, nor does it rule out all diseases. No matter what the outcome of testing, your doctor or genetic counselor reviews the results with you, and if necessary, they may suggest other testing or specialty referrals. Thank you again for watching. If you are interested in learning more about the genetics of hearing loss or would like to watch other videos, please go to the Center for Genetic Medicine Education site.